In this New Year edition of Generations, it's Thyroid Awareness Month, and we get the lowdown on just how important our thyroid gland is to our overall health. And Judy Jenks from Senior Centre CT.org talks about pets and how to find the right one for you. Hello, I'm Brian Scott Smith. Happy New Year and welcome to Generations, a podcast for people of your generation. January is Thyroid Awareness Month, but do you know exactly what your thyroid does and how important it is to your overall health? I spoke with Dr. Victor Burnett, Chair of Endocrinology and Thyroid Specialist at the Mayo Clinic in Florida recently, and began by asking him what exactly is our thyroid.
So the thyroid is a butterfly-shaped organ that lays in our lower neck, and it makes thyroid hormone. And thyroid hormone has effects throughout the body. I like to kind of make the example of it's a little bit like oil in your engine. It's essential for engine function. Oil is, and thyroid hormone is essential for function of most of our organ systems. That impacts our heart, our lungs, our kidneys, our bones, our gastrointestinal tract, and also our energy level potentially, and metabolism, and it can impact weight and such.
It sounds as if it's a very important part of the body, yet would it be true to say that we very rarely hear a lot of commentary about it?
I think there's definitely a need in the population to have more understanding about thyroid and be more aware about the problems that can develop with your thyroid. There's definitely a cohort of people who are very aware, and then there's a cohort who have never really heard of anything until they've had symptoms for a while and are finally diagnosed with a thyroid condition. And then it can have a significant impact upon their life. And many times they say, I wish I would have known, I would have asked questions sooner.
So when it comes to the thyroid, you've explained it's a very important part. It regulates lots of functions within our body. Who can suffer with thyroid problems, doctor?
So really, thyroid can extend from infancy to 100 plus. There are cases of where children are born with an underfunctioning thyroid or no thyroid at all, and we call that congenital hypothyroidism, when you don't have enough thyroid hormone in your system. I have one of my children was diagnosed with an underactive thyroid at around age 15, and there was actually no family history. And then definitely have patients that present in their 90s and hundreds with development of thyroid dysfunction that needs to be addressed. So it really spans all ages, a little bit more common in women than men, although men still can develop thyroid disorders. But I think they talk about a ratio of 8 women for every man as far as the rate of developing thyroid disease.
That's an interesting statistic. Do we know, does medical science know why it affects women at a higher rate than men at all?
Well, not directly. Indirectly, we know that women tend to have a more autoimmune conditions, and several of the conditions with the thyroid are actually autoimmune related. And so that autoimmunity seems to be more prevalent in women. There's hypothesis, there's an association with estrogen and effects on the body. There may be some genetic component too, and also the interaction of those with the environment. But we don't have an exact answer, but we do know that women tend to have more thyroid disorders, and again, also tend to have more autoimmune conditions in general as well.
Now, I'm looking at a website about the thyroid, and there seems to be a lot of things that can potentially go wrong, or there's conditions associated with the thyroid. We're going to touch upon a few of them, but two in particular that I just wanted to maybe start off with for like a clarification is hyperthyroidism and hypothyroidism. Perhaps you can explain the difference, doctor, to us about those.
Sure. So hyperthyroidism refers to a condition where the thyroid is overactive and putting out too much thyroid hormone. There's a similar or related term called thyrotoxicosis, which represents any form of extra thyroid hormone. So that could include being exposed to thyroid hormone in a supplement, or taking too much thyroid hormone. And there are times where the thyroid gets inflamed and released preformed thyroid hormone and it raises hormone levels, but technically it's not overactive in and of itself. It's damaged and leaching out the hormones. But so thyrotoxicosis is probably the bigger pie, and then hyperthyroidism is an important part of a piece of that pie. And again, one of the more common terms we will hear is a Graves' disease, named after a British physician from the 1800s who first described people who had enlarged thyroids and had overactivity, high pulse rate, and weight loss that was unanticipated, and a whole host of other symptoms. And that ended up being proved later to be thyrotoxicosis of the hyperthyroid type, where the thyroid's putting out too much thyroid hormone. One other thing I think is important to clarify when we talk about hyper and hypo is people get confused when we talk about the thyroid blood test that we use to diagnose this condition. In hyperthyroidism, the TSH, or thyroid stimulating hormone, that comes from the pituitary, which is part of the brain, actually goes low. When patients hear low, they think, well, I must not have enough. But this is the counterbalance to the actual hormones being made by the thyroid. And when the pituitary, which is part of the brain, feels like there's too much thyroid hormone, it actually goes low because it doesn't want to stimulate the thyroid to make any more hormone. Conversely, hypothyroidism is where the thyroid has become underactive. And it may be partially underactive, meaning maybe it can make 75 or 80% of what a person needs, or it could be to the point where it's making almost no thyroid hormone. And there, that TSH I mentioned actually goes high because the pituitary is trying to send a big message to the thyroid saying, please, please make some thyroid hormone. But unfortunately, the thyroid's damaged. It can't respond to that stimulating hormone. And the T4 and T3, which are the other hormones that the thyroid actually makes, go low. The TSH keeps rising. And that's a very accurate way for physicians and clinicians to determine if a patient has hypo or hyper. Again, hypo, high TSH, hyper, low TSH.
Is it fair to say, doctor, that hypothyroidism is more common or more commonly seen in older patients?
Yes, there is a higher prevalence of hypothyroidism with age. Again, a little bit higher in women than men. We talk about a general risk of hypothyroidism in women of about 3 to 5%, and men a little bit under 1%, but that can go somewhat higher as one ages. And so, and again, a little bit more in women, may get up into the high single digit to maybe up to 10% risk, particularly when you include patients who have mild or borderline thyroid failure.
And what sort of symptoms would somebody expect to endure or to suffer with if they say had hypothyroidism?
The symptoms will vary a little bit depending on the severity of how low the hormone levels have gotten. I hearken this to, if your oil's a little bit low in your car is going to run just fine. You're not even going to note it, although it may not get as good gas mileage and the engine might not last as long. Comparatively, where if the oil's extremely low, the engine won't function. So, and for patients, what this means is, so they may feel with hypothyroidism, unanticipated weight gain. They may feel cold. They may have dry skin. Their energy may be down a little bit. They may know that their heart rate's a little bit slower. Muscles may not be quite as strong. May have constipation. And there's some other symptoms, and I would refer patients to the website at the American Thyroid Association, which has a section and talks about hypo and hyper and gives a full list of all the symptoms. But I think those would be the main symptoms that we see with patients with hypothyroidism.
And staying on the subject of hypothyroidism, what are the general types of treatment then available to people if they are actually diagnosed with this condition?
So first, we do like to make sure we don't depend on one set of thyroid blood tests, because that can sometimes fool one, and we don't want to start thyroid hormone until we're sure the diagnosis has been solidified. And I'll mention one other thing before I talk about the treatment options. In the elderly, there's a normal rise in TSH once one reaches their 80s and 90s. And so we actually are careful to not diagnose somebody immediately with hypothyroidism when they're 80 or 90, when they have just a small rise in TSH. We really need to look at the T4. Do they have a family risk factor? Do they have enlarged thyroid called a goiter? And those things. But assuming the diagnosis has been solidified, the main treatment that the vast majority of people are on, and what is recommended by organizations like the American Thyroid Association, is T4 based therapy. So that means T4, which is the prohormone that is secreted by the thyroid, is made synthetically and turned into pills of different strengths. And the patient takes it once a day, usually on the morning on an empty stomach, and waits about 30 to 60 minutes until eating or drinking otherwise to allow appropriate absorption. And patients can do extremely well in this form of thyroid hormone. There is a older preparation called desiccated animal thyroid hormone. It has different various trade names, and that is an older version. Some people try to refer to it as natural, but it is natural to the animal it came from. It is not natural to the human body because the ratio of T4, which is the prohormone, and T3, which is the more active hormone, differs greatly from what is the human. So most patients do fine on T4 based therapy. And then some patients, we will add in some synthetic T3 therapy, sometimes a little bit in the morning and a little bit in the afternoon, although we'd be very careful to use any T3 containing products in the elderly because that goes directly to one's heart and bones and could exacerbate palpitations and heart conditions. If you have a tremor, it could exacerbate that. And if you have osteoporosis, could precipitate more breakdown of bone. So primarily people are treated with T4 and most people do exceedingly well on that. Another cohort will be in combination T4, T3, synthetic type, and a smaller portion, some doctors are still using the animal-derived thyroid hormone, but many of us that are thyroid specialists, that is not necessarily one that we feel is great to use and really don't advocate general use of the animal desiccated thyroid hormone by and large.
Now, another thing that you wanted to talk about before we started the interview was also thyroid nodules. Talk to us a little bit about that and what exactly are those?
So thyroid nodules is actually where your thyroid develops little knots within the thyroid. It is thyroid tissue, and many times it's benign, uh, but occasionally it can represent thyroid cancer. It is estimated that about 50% of the US population has thyroid nodules, and it's more prevalent as one ages. And actually, a good way to estimate is your age minus 15. So if you're 85, there's probably a 70% chance that you have thyroid nodules. And so these might be detected on physical exam. More commonly, what happens is they're relatively small, and somebody gets a CT scan or a carotid ultrasound or some imaging of their neck, and incidentally, thyroid nodules are found. And then there are guidelines on what to do. We like to know the thyroid blood test results with TSH and a free T4. And then a thyroid ultrasound will likely, a dedicated thyroid ultrasound will be performed. And then we have guidelines from like the American Thyroid Association, which say, okay, if this nodule is of a certain size and a certain appearance, it should undergo sampling. And then many of them we say, no, it's small, it's innocuous appearing, we don't have to worry about it. And I compare this to when you have moles on your skin. Your doctor doesn't take every mole off your skin. They look at it and say, oh, no worries. Oh, yeah, that one could be something we should go ahead and take it off. And oh, that one's really concerning and it should come off. And so what we do with thyroid nodules is we use ultrasound, and we have, again, imaging and size criteria that tell us this nodule is of higher or lower risk and can it be followed or should it be sampled. And in cases where there's thyroid cancer, well, patients usually work with a specialist like an endocrinologist or sometimes an otolaryngologist, or there are certain surgeons that take care of thyroid cancer. And we come up with a plan, and sometimes that will require thyroid surgery and additional treatments. Although many times people can do extremely well with thyroid cancer, but thyroid nodules are prevalent, and one shouldn't be surprised if they get a CT scan of their neck for something and then they incidentally say, oh, you had some thyroid nodules. And it can be evaluated and such. And many times it's nothing, but it's good to know that they exist and what to do about them.
With medical technology and modern medicine continuing to advance constantly, Doctor, what is the prognosis for people who have some form of thyroid condition, if they get it treated early?
So with the hypothyroidism, once put on thyroid hormone, the vast majority of patients respond very well. There are some people who continue to have symptoms, and we advocate to look for other potential causes. Many times we find someone isn't responding to thyroid hormone, excuse me, because they have underlying iron deficiency anemia, or they have untreated sleep apnea, and that's what their fatigue is from, or chronic pain issues. So a lot of times when we see people aren't doing well, we like to look for other causes, particularly if their thyroid hormone levels are indicating things are good. So if the TSH is in target range, it makes us nervous that maybe something else is going on. But the vast majority of people will do great. There is a substantial, it's a small number, but important group of patients that have hypothyroidism that just don't seem to feel 100%. And again, those are the ones we're willing to, after we've evaluated them for other potential causes, to consider these options of various combinations with maybe T4, T3 or things. But that's the minority of patients. The vast majority of patients, including my particular family member, does wonderful on just the T4 based therapy, and it's an excellent prognosis. With hyperthyroidism, it should be treated. It can be have heart issues and cause atrial fibrillation and abnormal heartbeat. Actually, President Bush got atrial fibrillation, to my understanding, while he had an overactive thyroid. That was the first President Bush. And was treated and such, and did extremely well, but it requires either some pills, sometimes radioactive iodine destruction of the gland, or in some cases thyroid surgery. But again, if one sees a specialist in thyroid disorders, it should be easily managed. And many times your primary care doctor can handle like hypothyroidism, but some of the other things you might want a specialist. And with thyroid nodules, many of these are just followed, and sometimes they grow or cause issues and then they have to be removed. But if they're evaluated, found to be benign, they're followed, and ends up being a routine medical issue. And again, I mentioned people can have thyroid cancer. Sometimes that can be more concerning, albeit the vast majority of people with thyroid cancer have an excellent prognosis, and the vast majority do not die of their thyroid cancer, but die of other complications of aging, cardiovascular disease, so heart disease, strokes, and other cancers, but not commonly of thyroid cancer on average.
If some form of thyroid disorder runs in the family, is it something that you should be concerned about and obviously mention to your doctor and have that checked out?
Sure. So with both under and overactive thyroid, one of the main causes, as we mentioned, can be autoimmune disease, and autoimmune disease can run in families. And there are families sometimes where 2 or 3 people have an underactive thyroid and a couple have an overactive thyroid. And then there's some that just have several generations of underactivity and such. There's also some family predispositions for thyroid cancer. That's not quite as strong. There's a less common thyroid cancer called medullary thyroid cancer, where 25% of those cases are actually passed on with a dominant gene from generation to generation. And then papillary thyroid cancer, which is the more common thyroid cancer, is usually not familial, but we do run into cases where there are 2 or 3 generations of family members having thyroid cancer, and it does seem to be familial in that smaller group of patients. And so, yes, I would say if you know a family member has thyroid disease that's directly related to you, it'd be a good idea to make sure your physician knows or clinician knows that, and that they can monitor your thyroid, do a good physical exam, and do blood tests as appropriate.
Dr. Burnett, it's been great talking to you, and I suppose the final comment to say is that if you have any concerns or there is a family history of thyroid problems, then basically always go see your primary care physician, and if there is something, then I'm sure they're going to be directing you to an expert like yourself.
Correct. So your first place is definitely start with your primary care provider, and they will guide you if they think they can handle it or if they need subspecialty support. And then again, endocrinology is one of the main subspecialties that deals with thyroid disorders, but we team again frequently with experts in surgery, in nuclear medicine, radiation oncology, who helps give the radioactive iodine and such, or the nuclear medicine doc. So definitely a team approach. But yes, start with your primary care doc.
Dr. Victor Burnett of the Mayo Clinic, it's been an absolute pleasure talking to you, and thank you ever so much for giving us a 101 into the thyroid, obviously an extremely important part of our body and certainly something that we shouldn't be ignoring. Thank you again for joining us on Generations.
Thank you, Brian. It's been a great pleasure to join you on your podcast.
And for more information about all things thyroid, visit the American Thyroid Association website at thyroid.org. And joining us as always is Judy Jenks from seniorcenterct.org. Happy New Year to you, Judy.
Yes, and Happy New Year to you, and we're in a new decade.
We are indeed.
Yes.
We are. So, what have you got to tell us in our new decade, your ode for this first one of the new year?
Well, Brian, I know that you and I both quite recently got puppies.
We did.
And I can't tell the listeners how much richer my life is because of our new little beagle, Harriet. She makes us laugh. She gets us up and moving. She's funny and smart. I think we're going to be in trouble because she might be a little too smart. CDC article I was recently reading states that studies show the bond between people and pets lowers stress, increases fitness, and brings happiness, which can lead to decreased blood pressure, decreased cholesterol and triglyceride levels, decreased feelings of loneliness with increased opportunities for exercise and socialization. Plus, pets can help us lose weight. When considering what pet to get, we should be considering how long the pet will live, what they eat, how much exercise they will need, how little or big the pet will be once it's full grown. Are pets allowed where you live? How much time do you have for a pet? And how much will the pet cost between vet bills, food, grooming, etc.? Another thing to consider is pet insurance. It's becoming more popular and can be quite affordable and can cover those unexpected illnesses and accidents. Before you get your pet, figure out what pet you might want, the cost and the time commitment, reasons why that pet might not be a good idea. Ask yourself, will my life be richer if I get this pet, or should I consider a cat instead, or maybe fish? And if you haven't had a pet before, you might want to consider a parakeet, a gecko, a gerbil, a guinea pig. They're pretty easy to care for. And remember the benefits: companionship, movement, and laughter. Pets can give us a whole new meaning and purpose in life. And my grandchildren actually visit more often because they want to see the puppy. Most households in the United States have at least one pet, and you just need to pick the right pet for you and your household, and we're all better off for loving a pet.
We are indeed, and I'm just going to say, I'm sure your grandchildren visit you to see you, because after that amazing Christmas list that you came out with last year, I'd be very surprised it's just the dog that they're coming to see. So I just wanted to get that on record.
Okay, thank you very much, Brian.
So, I mean, you're absolutely right. We got a puppy late last year. Her name is Griff. She's a little Labrador mix. Fabulous, fabulous little dog. But you're absolutely right. You have to think about, what is it that you actually want? We've got the time to look after a puppy. I mean, I'm quite fortunate. I work from home quite a bit, and obviously puppies do need a lot of exercise. They also need a lot of, sort of like eyes on them as well. So you're absolutely right. You just have to really think about this as well, because puppies aren't going to be for everybody.
And they're not puppies forever either. So, it's just that time frame that you need to go through. And, not with Harriet, but the puppy we had before that, I was working full time. No one was home during the day. And we did have people saying to us, the puppy needs more time. You're not home enough. And I really paid attention to how much that dog slept. And discovered the dog needs just a few pockets of time in the daytime. It needs to be quality time, and they're perfectly happy. So, it's not as though a dog needs a huge amount of time unless you pick a breed that really does need that time.
Yeah.
And then if you look at a cat, how much time does a cat need? Fish, you need to feed them once or twice a day, clean the tank, So there are pets out there for everyone if you're allowed to have them.
Oh, absolutely. And what was interesting is, we got a rescue because, not against buying it from breeders, but unfortunately there's a lot of dogs that needs like good homes in this country. And we just felt that, maybe rescuing one was, that was right for us. And we'd had rescue animals before, and it certainly has turned out, to be beneficial. But I think what was interesting about going through that process is the adoption agencies, for want of a better word, are very good. Always check out the adoption agency. But the one that we had was very, very good. They checked they wanted 4 references from us, from people that they could actually speak to. And we know that they spoke to them because we pre-warned our friends and family, and they said, oh yeah, we got a telephone call from the adoption agency, and they asked us quite a few questions. And also we had to allow the adoption agency to speak to our vet because obviously they wanted to check to clearly see, what sort of type of animal owners we are. And so that was actually very heartening to know that, the adoption agency was going through a process that, validated us, as people that, do care and look after, obviously, animals. But, I think it is something to bear in mind, do check out that adoption agency yourself, because it's not just about you. It's like, are you getting it from as reputable an adoption agency as well?
Yes, and then in my area, there's a couple of cat rescues, and people have been able to go, because we all know cats can be very independent and very different from each other. And they've been able to go, people have been able to go and pick the cat they're looking for, whether it's the cat that sleeps in your lap or, is out there playing or whatever. And that's a great resource because you can get the cat you want.
Yeah, we actually went to an adoption event, which was held, funnily enough, only 5 minutes from our home. It was at a PetSmart, so that was nice. So it was a recognised sort of pet store that does adoption events, and obviously many of them do. And yeah, so we went in there, and there were all the puppies, and it was a 2 or 3 hour adoption event. Come and see. So yeah, exactly. We were able to go in and meet the dog that ultimately we then adopted. So yeah, you have to do, I think, your homework. It's like anything in life, isn't it? Do your homework.
Oh yes.
Make sure you're happy with what's going on. And certainly I can only say that people say the dog picks you. I think to a certain degree it is true, because certainly when we found Griff, she certainly did seem to pay attention to us, and she's working out very well, and then obviously then going to the vet and getting her checked out, everything's good there. So I hope that we've got, and I think that we've actually got a very good little dog on our hands. So we're looking forward to obviously having her for many years. And
you were talking about the pet picking you, and that is what happened with us, with Harriet. We had done very similar as you, filled out the application, got approved, gone to some of those adoption events, and we were still looking, and then, we found this litter of puppies, and when we were trying to decide, which puppy, they said, call her, because we already had the name picked out. And I did, I called her, and out of the puppies, that's the one that came right to me. And she has known her name. I don't know how she knew her name before we got her, but she's always known her name.
And the other interesting thing, and again, because I hadn't, our previous dog, obviously we'd had for many years, and so you forget about what's going on in the world because, when you've got your own pet, it's all about that pet. So obviously when you're then going to find a replacement animal, I didn't realise, there's adoption agencies even for older pets as well, because we forget that sadly, people will pass away, and then the family members can't always, take on the animal, and then sadly that, that dog or that animal has to go into care, sort of thing. So it was interesting to see, what is out there. And of course, lots of people don't mind taking on, an older pet because, they're housebroken or house trained sort of thing, and they're a little bit quieter, and maybe it suits their lifestyle. So at the end of the day, they all deserve a good home. It's been great talking to you, and Happy New Year again, and lots of good generations coming up for 2020. We will catch you next episode.
Okay, thank you very much.
That's all from this edition of Generations. Don't forget to visit seniorcenterct.org to find out what's going on in your neck of the woods. And if you want to send us a topic to talk about or want to be our guest on the podcast, drop us a line by visiting the seniorcenterct.org website. Go to the bottom of the homepage and click the How to Advertise with Us link to get in touch. From myself, Brian Scott Smith, thanks for listening. We'll catch you next time.